Hi, my name is Rebecca Bubb with Pure Family Medicine, and obviously the COVID-19 pandemic is causing a lot of chaos in our medical system. So I wanted to talk about how our clinic is responding and taking care of our patients during this crazy time. Very little, actually. We've had convenient communication in place since day one. We've transitioned a lot of visits to telemedicine visits, but this has been an easy and seamless process for our patients as we were already communicating this way through our app. Unlike a traditional clinic, our office doesn't have to worry about reimbursements from an insurance company, so we're able to take care of our patients the best way that we know how. So we're very flexible when it comes to seeing them. We've been doing drive-up testing for patients who need to be tested for coronavirus. Like we talked about, we transitioned immediately to telemedicine, and that was a seamless process. So we don't have those protocols and regulations getting in the way of us providing care for our patients. And if they do need to go to the hospital, I'm on the phone with the ER doctor right away. So these are things that have been in place in our clinic from day one, whereas a lot of the traditional practices have been scrambling to try to put these procedures and protocols in place, which unfortunately has delayed treatment for their patients. First of all, our patients are healthier going into this because we have taken the time to make sure that their chronic medical conditions are controlled. Also, there's no barrier to care, so our patients can rely on me to be there for them. They can get an appointment if they need it, get a virtual visit, and get the treatment they need now and not have to wait a couple days like in a traditional practice. This by itself alleviates a lot of anxiety, which we know that everyone is experiencing around this pandemic. So our patients hopefully have that reassurance and are experiencing less anxiety than the general population. And then lastly, we're trying to provide a lot of education around this. So giving people the information they need to make the best decision for their health. No, not really, because we already provide that ongoing care for our patients, so they don't have to panic when something like this happens because they know that we're there for them. We're actually seeing an increase in the number of patients joining our practice because I think this pandemic is shedding a lot of light on the deficiencies in our medical system, and we know that direct primary care works. So I would encourage anyone actually who's watching this video to check out a direct primary care practice in their area because they're all over the country, and we are seeing patients when they need to be seen and how they need to be seen, and it's medicine that really works.